Hello again, everybody. I'm Dr. Julianne. Some of you might remember me as your Haka Life Physical Therapy Coach. Just as a reminder, I do have my doctorate in physical therapy, and I've been a PT for about 6 years. And in that time, I've worked with hundreds of people to achieve their health-related goals, especially as it relates to musculoskeletal problems. Now, today we're going to be talking about knee arthritis. I'll give you some background, a few tips, and a few exercises that are great for prevention and if you're already having some problems. Equipment-wise, all you'll need is some empty floor space and then a towel of some sort. So I've got a beach towel kind of rolled up here. So a beach towel will probably work really well because it's long and a little bit easier to work with. Okay, so that's all you'll need. Now, when we're talking about knee arthritis, if you've been listening to and watching my videos, I'm going to sound like a broken record because arthritis is similar anywhere in the body. Knee arthritis is simply a buildup of some excess bone inside a joint, and a joint is just where two bones meet. And that causes pain, inflammation, stiffness, swelling, right? All of these not very fun problems. Now, in the knee, really the only thing that we need that's different than anywhere else in the body is that there's this common myth that knee arthritis comes because you've been very active when you were younger, because you were a runner, because you played basketball and swam and did all of these hard weight-bearing things. That is simply not true. If you watch my hip arthritis video, you'll know that movement is absolutely beneficial for any joint, especially the joints in your lower extremities, in your legs. And so the more that you move, the more healthy and hydrated that joint is, and the less likely you are to have arthritis later in life. And we're actually finding that people who are more sedentary early in life are more likely to develop arthritis. Okay, so the more you move, the better. Okay, so always keep that in the back of your mind. Now, exercise-wise today, I have a handful of them for you. The first few will be about mobility, so keeping your range of motion, and then the last few will be about strength. So our first exercise today is actually a stretch for your calf muscle back here. It's called your gastrocnemius. It's a fun, ridiculous word, but that muscle actually starts down here and actually attaches above your knee. So it actually affects the way that your knee moves. And if that muscle is really tight, it can affect how well and how much range of motion your knee has. So that's why we want to do this one. So this exercise is the one that you want to use your towel for. So I'm going to grab my towel. And again, I've kind of folded it up so it's nice and long and not too difficult to finagle here. So all this exercise is, you're just gonna sit both feet in front of you. If that's not comfortable, you can bend one foot, and then you're gonna place the towel around the ball of your foot. Okay, so just like that. If you have a belt, that'll work just as well too, as long as it's long enough. Then you're just gonna straighten that leg and then pull that ball of your foot towards you. Okay, and so it's just a nice stretch there. So my calves are pretty tight, so this is a pretty good stretch for me here. Big thing is to make sure you don't let your knee bend up. Okay, so just keep everything nice and relaxed. Pull towards you. For this one, hold for about 10 seconds and then relax. Do 4 or 5 of them several times throughout the day. Okay, so that's a really good one for mobility in that knee. Okay, so that's your first exercise. Now, your second exercise is honestly not as great as a preventative exercise unless you already have some range of motion problems in the knee. So this one is more designed for somebody who's already having some stiffness, swelling, and pain in the knee. So this one is pretty straightforward. You're gonna straighten one leg, the leg that you're not working on, and you want to start wherever that knee is comfortable, bend it just a little bit, and then you're just gonna slide it straight out. If you don't have full range of motion, you may get stuck with that knee not all the way down on the ground. You really want to try to push it down, push that back of the knee into the ground, and then you're going to slide it up towards you. Okay, again, if you're already having some stiffness, this might be a little bit challenging. Go to wherever is comfortable. If you need to use your hands to help pull a little bit too, that's okay. Hold in this position for 10 seconds, and then go back here, 10 seconds here, 10 seconds here, back and forth. Okay, so 10 seconds both directions. Do it 5 times, several times throughout the day, at least twice a day. But the more you move with that one, the better it will be. So this is that whole idea of getting some movement in the joint, getting water inside that joint, helps with lubrication, helps with pain. Okay, so that's kind of the big thing there. Now we're going to move into some of our more strength-based exercises. So this next one is a really great one for your glutes, so your bottom muscles and your hamstrings. So even though your glutes don't directly attach to your knee, they're a great support muscle, and if they're not very strong, they can affect the way that your knee functions. Okay, so the stronger they are, the better you'll be, and especially if you're younger, the stronger your glutes are, the better you'll be later in life. Okay, so for this one, you're gonna lay on your back here, okay? And the big part here is I want you to squeeze your glutes, so kind of clench down here, and then lift your bottom up off the table, or up off the floor, and then come back down. So that's kind of the basic version. If that is somewhat challenging for you, keep going with that, okay? You want everything to be nice and slow, okay? If that's a little bit too easy, we can change it to a single leg bridge. So you're gonna pick one leg, straighten the knee, and you want your legs to be parallel to each other, so you don't want this leg down here all the way up here. You want them right about parallel. And then same thing, squeeze, and then you're gonna lift up and down. Up and down, okay? So for both of those, you wanna do them at least 3 sets of 10, just once a day. If it feels really easy with the first version, then move to the single leg bridge. Okay, so that is our bridge. And then our next exercise is an exercise for your quadriceps, so your thigh muscles. These are the main supporters of the knee. It's actually 4 different muscles. They all attach to the kneecap and the bones around the knee. So the stronger those are, the more supported your knee will be, okay? So for this one, we're just gonna do this. It's called a straight leg raise, okay? So you're just gonna lay on your back, one knee bent, one leg straight, and then you're gonna point your toes towards the ceiling, okay? Towards the ceiling, squeeze your thigh muscle, and then lift it up off the ground and back down. Nice and slow, okay? And make sure, again, you really squeeze that thigh muscle as you go. Okay, so with this one, you also want to do 3 sets of 10 at least, just once a day, because it's another strength one, so we don't want to necessarily be doing it multiple times a day, okay? So those are most of our exercises. I have one last one, and I'll meet you at the wall. Okay, so for our last exercise today, we're actually going to do wall sits, which for me brings back all kinds of memories of playing basketball when I was younger and doing wall sits for minutes at a time. So I don't have a great association, but regardless, this is a great exercise for your whole legs, really. Great for your quads, great for your hamstrings and your glutes. So all great exercises that help support your knee. Really good, just overall strength exercise. So for this one, you just need a blank wall space. Hopefully not a textured wall. If it is, you can maybe put a towel behind you so you slide down a little bit easier. Okay, so for this one, you're just gonna have, feet maybe about shoulder width apart, and then you're just gonna sit down on the wall, kind of try to keep your back against the wall as best you can. And I went down to, my thighs were about parallel to the floor. That's a good spot. I wouldn't go any deeper than that. Hold there for about 10 seconds, and then you can come on back up, okay? If you spend more time with your back straight against the wall, that's gonna really work on the quads more. If you do it kind of like I just did where my trunk is forward, that's gonna work a little bit more glutes and hamstrings, okay? So it's really up to you on what you wanna do. So for that one, hold for about 10 seconds. You can increase the hold time to make it harder or easier. Do that at least 5 times every other day. You can increase that based on your comfort level, okay? So that is your wall sit, and that is all of our exercises for today. So we've got all of our solid knee exercises. And remember, at Haka Life Nutrition, we believe in a whole body approach. Get moving daily, eat well, and use quality supplementation. And remember, always remember, you are a warrior, and you can do anything you put your mind to.